Hey, we're Koifly Creative, and we're obsessed with all things production, marketing, business, and helping you navigate the life of a creative leader. We're here to unveil the more unexpected aspects of leadership. We don't stray away from the real talk. We go through it all with influential leaders from all walks of earth. So, pull up a seat and have your morning coffee with us. This is the Morning Cast.
Welcome.
Good morning.
Good morning. Welcome to the Morning Cast. I'm Shelly.
I'm Dave.
I'm Erin.
I'm Stacy.
I'm Leslie. I feel like I always go last.
You always.
Well, I feel like that's good. Zoom
Last but not
problems. Yeah, so today we have Stacy bringing in her friend Deb. Can you tell us a little bit about your interview today, Stace?
Yes. So today is Deb, my good friend Deb Daller, who I've known for years and years. She's been a nurse for, I think, decades, and she's now working directly with COVID patients in testing centers and in an urgent care in southeastern Pennsylvania. So she is sort of on the front lines, but in the front lines in the suburbs. So kind of a different slant on that. And she's she could be a smidge controversial. Like, so this is like, you know, not everyone that we interview has our exact, you know, this is not our opinions as Koifly. This is an opinion of, you know, whoever is out there. And, and I appreciate her opinion because she has a lot of information and she is a medical expert. And so I delved into that. So I think it's exciting. I enjoyed it.
Cool.
And she's a sweet, sweet person. Like she works at the urgent care. I bring my family to her. Like, if we're sick, we're like, let's go see Deb, you know, so she's great.
Awesome.
Right on.
Yeah, it's good to have, you know, it's challenging when there's a lot of different opinions, but you know, opinions versus fact, it's all everything that we hear pretty much is subjective until we see like a written report on paper, right? So I mean, all information is good information in my mind, so I'm excited to hear what she has to say.
Yeah, and like she's very convincing, so
Cool.
I'm excited for you guys to watch it.
Thank you all.
Nobody got
Let's
that.
roll this piece.
Let's roll. Go.
Look at that.
Go. Introduce yourself, Deb.
Hi, yeah, I'm Deb Daller. I'm a nurse at an urgent care here in southeastern Pennsylvania. I work in both a regular setting, urgent care setting, and in a COVID testing site center. Been a nurse for a long time and done ICU nursing, emergency nursing, trauma nursing, and now I'm in an urgent care setting.
Wow. So I think I just have so many questions. And I think like what you're doing right now, I feel like a lot of people want to hear about. You know, obviously you were just telling me that like, you know, people are asking you questions and want to know like the details about what is happening in your world. So like if maybe you can just kind of walk me through like what your job was before this thing happened and then how it's changed.
Okay, yeah, there's been a huge change actually. We didn't realize the change, and I think it's not really focused on as much anymore. So number one, I just want to point out, I don't know anyone in healthcare right now, as all the people I know are not heroes. We just don't feel like we are. We appreciate it when we're noted to be that, but we really don't think we are. It's our everyday job. So before this, we were very busy. We were seeing, 40, 50 patients a day that would come in with really kind of insignificant sniffly noses and that sort of thing, waiting long time to get in to be seen, that sort of thing. Now with this COVID outbreak, if you will, people are staying home. We are seeing between, 10 and maybe 12 patients a day, sometimes 5 patients a day in the regular setting, urgent care settings, where they're coming in with lacerations. People are home, so they're cooking and they're doing things that they always do. So it's very interesting. A lot of lacerations are occurring out there. They're pretty
like, so people are like, I'm sorry, that's not funny, but I'm just saying like, that's the thing. Like they're cooking so much that they're cutting their fingers and stuff.
They're building things and they're working on their house and they're, so it's good. So we're there for them and they come in, but they really, really want to talk about things. They want to know what's going on. They really want to know what we're seeing and what reality is compared to what maybe might be on the news. And it's pretty different. Again, people are staying home. Now at the COVID sites where we're doing the actual testing, that's very in and out, that's very quick. And we're testing lots and lots of people. The symptoms, unfortunately, are changing very rapidly, literally
Wait,
from
what?
day to day.
What do you mean?
So the symptoms are very widespread. So it's very difficult for us to triage people and not do a lot of testing. Right now, we're testing any healthcare provider that comes up positive for 2 or 3 symptoms, and that has changed. We have the tests. We have not run out of any of the tests. They're coming back quicker, and a lot of negatives. So that's a great thing, really, really good thing. People are finding that they're scared. They're really scared. And so when they come in, it's nice to be able to reassure them, talk to them, let them know that we're all really doing good. I've worked with a number of positive COVID patients. I'm healthy. My coworkers are healthy. Taking care of yourself is kind of the biggest thing out there for us. We protect ourselves by, wearing masks and that sort of thing.
So what do you have to wear, like when you're at the COVID testing center? Do you have like specific, I'm assuming like gloves and masks and what?
We do. Our urgent care has set up a complete way to do everything. They've been great with it. We have the N95 masks at our testing sites. We then glove, then we gown, and then we glove again. And then, of course, we have our goggles that we wear. The only thing that we don't have that I used to always use as a trauma nurse was we don't wear booties or a hairnet. So we're very careful with how we go in and out of the rooms. So every room is disinfected after every single patient, shut up, closed up for the allotted amount of time, and then we reopen it for the next patient. They're in and out quick. Unfortunately, we have to have a security guard at those sites.
Why?
Because people are just trying to come in without being noted. We're stopping people and they're calling us from their car. They let us know what's going on. We register them out in the car. We triage them. I triage them over the phone while they're out in their car. And then they just kind of come in. We give them a mask. They go in their room. Our provider swabs them, and then they leave.
Are the people, when the people come in, like, so wait, so you're saying that they're out in their cars and they're like, so just trying to put myself in like one of these patients' shoes. So like,
okay,
they're thinking to themselves, I'm sick. I must have COVID. I got to get to the clinic, right? Is that like, what do you think's happening in their brain?
Yep, that's exactly it. So there's a hotline that we have 19 urgent cares in the one I work with. And 6 of them right now are testing sites only. And so if they call any one of our urgent cares, we would just transfer the phone call to one of our testing sites. And then the provider and the nurse there would talk to the patient, triage them, if you will, that is what we call it. And we find out what their symptoms are and how long. And we have a whole dialogue of what we need to ask them and find out. And if we feel like they need to be tested, then we tell them to drive to our site or one of our testing sites, stay out in the car, call that specific site. They will be given to our registration personnel. They will register them, get them completely done while they're still out in the car. We will triage them again if need be while they're still out in the car. And then they're told to come back in at a certain time. We only want one patient at a time in the urgent care testing sites.
Wow. So when you triage them in the car, are you actually going out into their car and like?
No, it's all done verbally. What their symptoms are, how they're feeling. It's all put down into their record on their database, on their own database. And then when they come in with their mask on, when the security officer lets them in with their mask on, they're told to go straight back to the room. The provider that I've already gowned up and made sure that they have been sufficiently taken care of, goes into the room, talks to them a little bit more, gets their vital signs, and then does the nasopharyngeal swab and opens the door and just drops it into the bag for me, which I then seal up.
Wow. So how are the patients, like, I'm sure it varies, but are they nervous? Are people freaking out? Like, are they,
I think they are. By the time they get to us, because it's such a strange, like I was just explaining it to you, people haven't done this before. So I think they're a little nervous. Some of it is that coming out as kind of different symptoms. They're a little more psychosomatic. So, if they're telling me their heart is racing and they're nervous. I mean, that's kind of the clinical thing that we have to remember. And that's why we are healthcare providers, because we kind of dig our way through that, especially working in urgent care or in emergency. You kind of know who's a little more sick and not just by talking to them and looking at them. That's our job. That has not changed.
Who's like the sickest, like what's the sickest patient you've seen? Have you seen someone full on like in the midst of COVID?
Yep, I've seen, we had one the other day that came in, very high temperature, very labile, so it kept going up and down, but never went below 100.4. 0.4, remember, not 104. His very high blood pressure, and he was a nurse in taking care of in a local hospital that was taking care of positive COVID patients. And unfortunately, we don't have his test back yet. Unfortunately, I'd like to tell you I had that back, but I don't. And he was worried. He has 3 kids at home and a wife, and he was gonna go to a local hotel to stay away from his family.
Yeah.
For a while, at least until he got the results back.
So do you guys do chest x-rays on him? Because I spoke to an x-ray tech, and she's literally basically the front line of her hospital, where she goes and she does like portable chest x-rays, and that's before they even get test results. That's where the suspicion comes from. Is that one of the things you guys do to check?
We do. And we did a chest x-ray on him, and there was some difference to his chest x-ray, and we let him know that. And so yeah, chest x-rays look very different when you have COVID patients.
I've seen them. We looked at them together, and I was like, wow, it looks almost to me like cotton candy or like cotton balls. Like,
it's almost, we call it honeycombing. And so it looks like a little honeycomb kind of in their lungs when it gets really bad, but it starts out exactly what you just said. It starts out looking that way, and that's how his looked. So that was a little better because he wasn't still really full blown. But
that's good. That's good. Yeah. Maybe he doesn't have it. I don't know. Hopefully he's just, we're still seeing influenza here. People have to remember that too. Right. Not every single sick person is COVID. A lot of people, we just had 2 people last week test positive for influenza. Wow. And they were really, really sick. So we did both the flu and the COVID testing on them, and the COVID was negative and the influenza was positive. So how long does it take to get back the COVID test?
It depends on which testing site they use, and that's not up to us. We kind of send it, and they kind of disperse it out. Department of Health kind of decides on that. I think they're trying to get, I'm not sure about this, but from what I understand, they're trying to get the healthcare provider results back as soon as they can, because they want to know who they came in contact with, and so that they can do their due diligence with, notifying and keeping those people safe also.
So for you, like going in and like being in a testing unit or whatever, like I know like your mom, you work, like you have kids at home, like we're all in this like quarantine together, but how is it different for you? Like, do you have to, like I know you and Kels are still hanging out, like, do you have to like stay away from people or like in your house?
We take full precautions there. And I think at the COVID testing site, we were just discussing this yesterday, because yesterday I worked at my regular urgent care, not at the testing site. And, we consider every single person positive that comes through that testing site until they're negative. And so we're very safe there. It is more at the other urgent care, the regular urgent care, because people don't know if they are sick. And so last week, unfortunately, we tested 3 people that came through our regular urgent care with COVID symptoms. And I didn't have my gown on. I didn't have we don't have N95s in our regular urgent care.
No.
They're not available. So we wear regular masks. I mean, that's what we do. We don't have enough gowns to go around for every single urgent care. It's only the testing sites that have the N95s. So we were, unfortunately for us, all 3 tested negative. So that was good.
Good.
Those are the worrisome parts. So when I come home, I disinfect, I shower every night. My kids are very positive and supportive with getting that done right when I get home, and washing my clothes every single night, drying them well. So
Do you take your clothes off? Like the X-ray tech I talked to, she literally takes her clothes off in the garage, and then like she sprays like all the like. What's your like routine?
Yep. So I don't have a garage. So I do come in and I strip down right after I shut the front door. I leave my shoes in a certain spot that has we just put it on like a brown bag and we spray them, because again, we don't have shoe covers, which I would really like, but we don't have them. Strip down, put my clothes into a brown paper bag, and walk upstairs, take my shower, come downstairs and put all my clothes into the washer, and kind of get on with life.
So, and do you shower completely and stuff? Like, do you come in and shower, or do you just wait till the next day, or like?
Oh no, yeah, I shower at night. Yeah.
That's a change, right? You can't
It
even
is a change.
It must be exhausted. You can't even just go right to sleep.
Yeah. Well, there's a lot that I stay up late. Again, this has been my job forever. I remember when SARS broke out. Like I've been, when that came, we were all very scared of it. When I started as a nurse, HIV was still really, really kind of new. And that was when I first started as a nurse. And that was very scary for all of us. We had never seen HIV kind of go through, whereas coronavirus has been around. So yeah, it's just kind of another one of those things that we just do as a healthcare provider.
Yeah. What do you guys think?
So good.
Testing's so hot right now.
Testing so hot. What do you mean?
I mean, that's like the big thing, right? And I get it, because you need these data sets in order to figure out what the hell is going on.
Yeah.
And it's just interesting to hear, because she's saying like these people are coming in and they have more of like psychosomatic symptoms, and I get that.
Yeah.
Because we went and got tested yesterday.
Yeah.
For the antibody, to have the antibody test. And yeah, I mean, even just leaving the whole house with the whole family and walking, going there, it's scary. It's because it's not normal. You pull up into a parking lot, they make you call a number, they give you a pound sign to dial into. One at a time, you walk in, everybody's covered from head to toe, nobody's in the building. It's strange. It's like I could see where that happens.
Yeah.
Yeah, I thought it was crazy that she said there was even like they have security guards there making sure, everybody stays in their place. It's eerie.
Yeah, she talks more about that, like as we go through too, about the security guards and stuff like that. Like there's something that people are doing that is crazy that I had no idea was happening.
Oh my gosh.
That she talked about in the second half.
I think an interesting side effect is that the regular people that they're seeing in the urgent care are people that are injuring themselves because they're stuck at home.
Yeah.
Like,
I mean, I didn't want to like
normally
talk
do.
about, but I'm like, they're seeing more lacerations.
And it's literally like I burn myself all the time when
I literally just cut my thumb.
Yeah.
Like I literally just did this like an hour ago. I'm like,
I mean, it's not funny, but it kind of is, because it's like, how do things shift, based on the fact that we're all sitting in our houses?
Yeah.
How can you hurt yourself? But you can.
They're doing construction jobs and cutting themselves.
Exactly. It's so true.
Yeah.
Such a part of that you don't even think
The
about.
weird side effect of COVID.
It's so true.
possible side effects, lacerations.
All right, so you want to go back in?
Yeah.
Do it.
Laura from Deborah.
All
Yeah,
right.
that's it.
All right, okay.
Let's do it.
I know you, and like you're that kind of person, but there has to be times when you feel like scared or nervous, or like, I mean, you're like, I guess maybe my question is like, where do you put your brain so that it doesn't go down that path of like, because people that I know of are scared to leave the house, but yet you're
right, which is very.
I'm trying to figure out like where does that come from, and like, And then is that a two-part question? And then are there times when you're like, dude, I am not going in today? Like, and that's fine. And I think that's like, okay to be vulnerable like that and talk about stuff like that too, because, but maybe not, maybe you never are. Maybe that's why you do what you do.
You know, that's you make a great point, because and again, we discussed this at work, because you know we got each other's back. We're in the trenches together. What you'll find is emergency personnel, your pre-hospital personnel, your trauma, your surgeons, all these guys. We are a different kind of breed of person, and so we don't really allow ourselves, we try not to allow ourselves to go down that path, because it's a dark path. I mean, we take care of, you know, sick people that have this huge life-changing episode in their lives. Their families are affected, and you really, that's when we stay focused as professionals, and we just know we have a job to do, and we have to do it because there's no one else doing it. Now, does it weigh on you? Yeah, I mean, I worry about my kids. I worry about me being there for them and that sort of thing. But again, I've done this a long time, and other things have been out there. I'm not scared to go out. I don't wear gloves and a mask when I go out, unless my governor now tells me I have to. But I wash my hands a lot. I don't use sanitizer. Never have. I wash my hands. That's what I do. That's your best self-defense. I can't believe lotions like not out of stock, because I use a ton of lotion every single day. You wash your hands and your hands are so dry. So yeah, it's a different type of person that works kind of in my arena, which is all good.
If you were going to like say words, like what type of person is that? And I know you probably don't want to like, let's talk about like a doctor that you work with, because I know you don't want to like tout the things about yourself, but like, or someone else that you work with, like, what is the characteristics? Like, what is it? Like, that's one of the things I'm really trying to figure out doing this series.
Yeah. I think, we're the type of people that we're going to jump in no matter what, whether it's good, bad, or indifferent. And then we turn around and go, ooh, well, probably shouldn't have done that, but everything is all good. That sort of thing. Very independent, yet have a lot of empathy. I know the people I work with, the nurse practitioners, the PAs, the other nurses, the LPNs, we really kind of look at people as our own people. You know what I mean? Like when a patient comes in, I want to know everything about them, because I really care about what's going on with them. You know, I like to hear about their family, and you make small talk and that sort of thing, because that reassures them. And they're not just, lacerations of the left hand. They're not just a broken ankle. That's what I think doesn't always come across. I think we come across very like, get this done, then get this done, then get this done. We got to, focus on getting people in and out, in and out. And really deep down, we do really care about the people. But again, we have to be very careful about going down that path, and just laying our hearts open. And it's a big struggle.
You have to separate, right? You have to separate it, because like I know you have this like really, because my kids have gone to you, like we've come in, like and my husband, we've come into you as the nurse in care, like in this clinic, and it's like this warmth that you have.
Oh,
but you're getting your job done. So I feel like it's like a really unique sort of talent, and and not every caregiver is like that either. Like I know there's a lot, especially specialists who are just like, let's get this job done, and they're, I have 10 minutes to be with you, and insurance doesn't pay me for like any more than that. Yeah. You guys, like, you're definitely not that, you know what I mean? And I think that's probably one of the reasons why you're successful and have stayed in this business for so long. So
agreed. That's it's definitely, I've seen lots of people come and go. I mean, I have seen a lot of residents come into the emergency department when I was in the department, and it's not for them. They know they want to go into GYN, or they want to go into dermatology, or they want to, and I have no doubt that when people say this isn't for me, they get out. I mean, we've had docs come through, doctors, not just PAs and nurse practitioners, come through our urgent care and say, this really isn't what I want. I want to be in a doctor's office. I want to be in, 8 to 5, Monday through Friday, and not friendly, but I just had a really great group from my school of moms, senior moms, deliver us food yesterday. They brought in barbecue, and it was very sweet, and you know, that it touches our heart. So instead of always being called heroes, which, you know, we're not, we still need our garbage men. Like, God forbid they should go anywhere. We still need our, you know, mechanics and our, you know, landscape. We need everybody. So I think everybody right now has their part to do, whether that means you stay at home and keep your kids happy and, you know, healthy, and, you know, cook for them and clean for them, and, you know, do everything you do. You're just as much as a hero. We're all in this together. It's just, we need to get back to normal. We just need to realize that this is out there. It's not killing the amount that we're you know, worried about, and let things reopen. Let's get back to business.
All right.
And yeah. Oh, I don't think anyone I work with feels that we need to just stay in more. We all really want to get out there and
work. I love that idea. I want to myself. So tell me how else, like, so you said that people have dropped off food to the clinic. Are there other ways that we can help you as the normal human to support like what you guys are doing?
Yeah, we have had a couple of places drop off their masks that they weren't going to be using. There was a veterinary office that had an oversupply of it, and so they did drop off some of the N95s because, again, you know, we don't use those in regular urgent care, and unfortunately, we do get some patients in with that. Any sort of gloves like that, we go through a lot of gloves. We have to, you know, mask and glove with every single patient, and so we're really a huge turnover with that. We unfortunately have to keep those under lock and key too now, because people panic and that sort of thing. But
like patients,
not panicking.
People who work there, like who's?
Yeah. Patients that, you know.
Patients are stealing gloves?
Well, they're in the room alone. And so sometimes they get a little nervous and they panic. But we try to reassure them and let them know that, you know, we're always here for them if they need anything and that sort of thing. Also, more importantly, I think what we all want everybody to know is you really need to educate yourself on what gloves do and what masks do and what they don't do. So they're not a force field. You know, whatever you touch, you're also then contaminating. Just because you have gloves on doesn't mean that your hands now are invincible. So when you go to the grocery store and you're touching the cans and then you're touching your face, or you're scratching your hair, or then you're touching the handle to the cart, and then you're touching fruit, and then you're touching your mask again, and then you're contaminating everything. So I think patient education is really more what the news needs to focus on, instead of telling people that they need to stay in, because people are not staying in. We all know that. We've seen the grocery store lines, and we've seen, you know, that sort of thing.
So they're telling us to wear masks now in grocery stores. Should we wear masks? Like, is it helping us? And gloves? Do we need gloves?
So the masks are good because it is a droplet. They are good to wear in case anybody does cough. They're good to make sure you're not giving any, you know, droplets out and that sort of thing. Gloves, people are just not using them correctly. They're just not. They're touching everything and then touching their keys. Okay, right. And they get into their car, right? And their gloves are still on, so they're opening their car door. Now you've infected your car door. So you're getting in your car and, you know, you're turning the key on and you're putting your windows up or down, or you're turning the dial to make it warm.
If you wear gloves in the grocery store, you should take them off immediately after.
Yes, absolutely. And your mask, you don't want to touch the outside of your mask now because your gloved hand touched it.
Oh no.
So you want to take off the loops and you want to take it off from the side. You know, that's us. Can
you wear like a t-shirt or like a bandana? Is that okay?
Yeah, anything works. Anything works. Especially when you're just out and about with people. I mean, that wouldn't work in our settings as emergency workers, but that does work out. It's really just kind of protecting yourself from the big cough. And I don't know if you do, Stace, but I don't find when I go out that people are going out there and coughing away or sneezing, or people are really doing well. I think the healthy people are going out. And I think it's been reassuring that we're getting a lot of these negative COVIDs back, and the ones that are positive, they're really very, very low symptomatic. Like their fevers are low grade. They're not spiking really big anymore to 105. Some are. Now, it's science. So believe me, for every time I say it's a low grade, somebody else is going to say, yeah, but this person was high grade. It's a science. It's, a whole spectrum. It's not just this type of person has COVID positive. So, but they're coming in with these little coughs and that sort of thing.
That's what I was just going to ask you. Like, so what are the main symptoms that I need to worry about then? Like what?
Right. Okay. So,
it's varied, right? You're saying like the symptoms are changing and it's varied and
it's completely varied. So we don't even triage. When we triage, we don't ask anymore if they've been, if they've flown to a different country. Have you flown recently? We don't even ask that anymore because that time frame's gone. Like, you know what I mean? The 2-week onset, the 2-week incubation period has kind of petered itself out. But we do ask people, are you still going to work? Where do you work? What do you do as the job? Do you come in contact with people? Do you have a cough? Do you have a fever? Do you have chills? Are you fatigued? Is anyone else in your house coughing? Do you have difficulty breathing? Are you short of breath? And then after you get all of those symptoms out of the way, you want to know, do you have asthma? Do you have any underlying disease? And that's what we're finding. People that do not have any underlying disease process. I mean, even if you're taking a pill for it, you still have it. So a lot of people will say, no, I don't have hypertension because I take a pill.
Mm-hmm.
You still have hypertension. So any underlying disease process, those are the patients that are really having a difficult time. If you have asthma, if you have diabetes, if you have any of these cardiac problems, if you have, COPD, if you have congestive heart failure, those underlying disease process patients are having a hard time. Those are the people that should not be going out. Those are the people that should be staying in. Healthy people, I think we need to let them get out and start our businesses up. And
a quick question. So like about the symptoms, like I read an article like early on that said, if you hold your breath for 10 seconds and don't cough, you don't have it. Is that true?
No.
Because I've been doing it. Damn. I've been doing it. I've been like, okay, I feel this might be allergies, but let me just hold my breath for 10 seconds. And if I cough in 10 seconds, then I have COVID.
That's exciting. I've never heard that, but yeah.
Well, I mean, it wasn't directly from a doctor, so.
Oh, really? Okay.
I think people are kind of holding. I think
Yeah.
people are holding on to any sort of like self-diagnosis that they can, like, or,
Yeah. Well, I'm glad they got the docs that are doing the video chats, like a teledoc and that sort of thing. That started up. That's been very helpful because it is season for allergies, right? So Zyrtec and Claritin and all those really need to start. Antihistamines, before you think you might have COVID, start if you're not allergic to anything. Really, antihistamines are go-tos right now. We're seeing a lot of people with sinus infections and ear infections because it's where we are right now in Southeast Pennsylvania. Very windy lately, right? And then you have really warm day and then a really cold day. And so that really wreaks havoc on your immune system, and your histology in your body is just going crazy. So those antihistamines will really help people. If anybody gets a cough, they go, oh my gosh, I have COVID. Well, it could be post-nasal drip. So gargling with salt water if your throat starts to get a little sore is always a go-to with me. My kids, they know not to even come to me with a sore throat because I want to make sure you haven't gargled for like 2-3 days before you even talk to me about this.
I love it.
Yeah.
Well, that's good to know. Okay, so, and then I just want to find out, like, it just seems like you're not nervous, like, like and I don't know, and I don't think you're like just like not actually nervous just because, like, I really think that you.
No, I'm not.
This doesn't seem like it's like a daunting thing to you.
It's not.
Like, it's pretty refreshing because, like, I've talked to so many people that the other X-ray tech I talked to she's in Jersey, you know what I mean? And it's like, it's super hot spot there. And then people who are in Philadelphia, like, there's hot spots there. People are getting like beat up getting off, if they're not wearing a mask, they're getting beat up and like pulled off buses in Center City, Philadelphia. But maybe is it because we're out in southeastern Pennsylvania? Like it's not you're nervous, or just like in your head, it's not as bad as the other ones.
Yeah, and my I'm sure a lot of people are going to disagree with me, but I'm not nervous. We're not seeing it, or we're just not seeing really in my urgent cares that I've been talking to with people, people are being COVID positive and surviving. They're not surviving influenza as much. I mean, you need to really look at the numbers. Heart disease, influenza, cardiac disease, those are still killing more people today, every day, compared to COVID. And you got to remember, they're not being, killed, if you will, by COVID. It's all their underlying disease processes. Most people have respiratory problems. They have a positive COVID test, and their respirations and their shortness of breath and that disease process just flares up, and now it's hard to breathe. So, but you find that in influenza patients too. So if you have an underlying cardiac and respiratory disease process, influenza might kill you. I mean, unfortunately, and that's not new. And I think that's why I'm really not nervous, Stace. I go to work, I have no problem. I work all day.
Even though there's a vaccine for the flu, but there's no vaccine for COVID.
Right. And what would be more interesting is, let's see how many people actually get the flu vaccine. Because I guarantee you 50% of the patients I ask, because that's a typical question for our triage, don't get the vaccine. I mean, let's be honest, people are not vaccinating their children, and they're still sending them to school. And we know that's real also. That's database driven. That is not something I'm making up. People do not get the flu vaccine, so why are we worried about a COVID vaccine? I don't think you need to panic. I just don't think people need to be punching anyone in the face. I don't think I know of a nurse that she got up, she threw some scrubs on. They were another story here. You know me and stories, Stacey.
Yeah, tell me some stories. I love your stories.
So she got up, she just threw her scrubs on. She was off that day. She had, they were not dirty scrubs. A lot of us, if you know any people that work in medicine, scrubs are really kind of comfy. So we throw them on all the time, and that sort of thing, especially, older scrubs, you just throw them on. She went to the grocery store, and she got punched by someone because they thought she was wearing dirty scrubs that she had come from the hospital with, and she had not. That's just
wait. Can we roll that back a little bit? So your friend is a nurse.
One of my friends had another friend, her friend, and she had called her and said, "Oh my God, this just happened to me." Yeah, she went to the grocery store,
and someone just cold cocked her. What? How did the punch happen? What?
Yeah, that he was just angry because she had scrubs on. She was in a grocery store with scrubs on, and he was angry with that. And so he was like, "You need to be. This is not right." And he just kind of punched her
in the face. What?
Yeah.
Did she call the cops?
Yeah, no, I don't think she did. I think she just kind of rolled with it and just was like, "Okay, dude, you're out of line," and she just kind of left. And yeah, this is, if you look at the age of these people, we're not really finding a lot in pediatric patients, which is great news. More of it is your 30 to 50-year-olds are kind of testing positive, but not really getting overly sick. They're just have some of the signs and symptoms, and they're really kind of getting over it, and they're healthy. Where you're finding a lot of the deaths are your older population. And that's, I think, very interesting, because most of those people, again, have underlying disease processes going on. So that's not out of the ordinary, because who are the people that die from influenza? They're your older patients. They're your patients that are immunocompromised. So we're finding this virus is actually kind of acting like a typical virus. That's, you know what I'm saying?
So I don't know the numbers on this stuff, but how many people has the flu killed this year?
I had the number 2 days ago. I had a number, so it's probably not up to date, but it's a significant amount more than COVID has
wow.
that we know of. Because now remember, we didn't start testing January 1st for COVID. So the numbers might be a little skewed that way. But the people that are actually dying, the patients that are like, unfortunately, are not surviving are that your older population and the ones that are immunocompromised. That's what I want everybody really to take away from is you don't have to panic. Get healthy. You know, don't go over and above, because we have a lot of people coming in with a lot of musculoskeletal pain because it's, you know, they're starting to work out and they're lifting and they are not used to it. So start slowly. You know, stay healthy. You know, drink your water just like you always have done. Take your vitamins. Eat right. There you go. Eat right. You know, stay away from unhealthy foods. You know, everything in moderation. You can have sugar. You can have fried food. Just have it in moderation. Do everything normal you're doing. That's what, and that's how you're going to stay healthy. And wash your hands and don't touch your face.
What'd you guys think?
Well, I have a lot of questions.
I figured you might.
I guess where my confusion is lying is in the lack of information that has been given to the general public regarding death rates and negatives and positives and who has it and who doesn't. And the amount of deaths was X number by this month, and now it's X number by this month. And I have trouble understanding, you know, more people die of heart disease than this, but heart disease isn't contagious. And so
I do not.
If people who are the older population that are in immunocompromised people are the ones that are dying, isn't it socially responsible for us? Why is their life not?
It's not like it would be different if they are by themselves at home.
Yes.
But it's when you interact with those people that I think.
Right. So I don't feel comfortable personally being out and about, not knowing what all the real stats are. And I think that comes along with the fact that this is a novel coronavirus and not just like a coronavirus, you know.
Nice,
it's
Kevin.
a first timer, and everyone's still trying to gather this information. So I think that's kind of where a lot of people are. But you want to listen to medical experts, right? And if they're saying, hey, let's go back to work if you're healthy, then take that with a grain of salt, right? But then how do we do that and protect the most vulnerable?
This was also a couple weeks ago. So I think as time's gone by, things have gotten even more extreme. So I don't know if I talked to her today, if she would still feel the same way. But she's also like been through SARS and AIDS and, you know, all the things. So maybe she's desensitized more than most people would be like us. I don't know. What do you guys think?
I get concerned when I hear the comparison to influenza. As someone I know got this virus and passed because of it, someone not older, someone not in bad shape or anything like that, who's survived 40 plus flu seasons.
Right.
I feel like that number, you know, I feel like that comparison is dangerous to tell people. Mm-hmm. Because we don't know so much about this virus still.
Right.
Even if it's 2 weeks ago, you know, so much has changed. And so I don't think that comparing death rates is the right thing to do right now to make people feel better. Considering the death rates have been going up and they're saying recorded deaths have been, you know, happening since even before we thought. Like, so I do have trouble with that comparison. Coming from anyone.
Yeah, I think I heard it too. There was a doctor from a hospital in Philadelphia who I think really was eloquent about explaining that. He said something like, so the flu, you know, it's we're used to those symptoms and it's been going on for a certain amount of time, and you have deaths from the flu, but this has happened, like we really only have stats within the last like 2 months. So it's like having a year's worth of flu happen within 2 months, basically 3 months. And he's like, it's like if you went to like McDonald's and you ordered like 50,000 cheeseburgers, you know, it's like what happens is the system fails in those places. So like where we are out in Chester Springs or in southeastern Pennsylvania, it could be a slower drizzle.
Right.
But in those areas where, you know, people are dying, like New York, like, unfortunately, sorry about your friend Dave, like, you know, it's horrifying, like what's been happening there. And it's a different situation. So, so I think it's interesting. And as I said in the beginning, like, it's controversial. And she even says, you know, people are going to totally disagree with me. This is just, you know, kind of what I'm thinking, but.
Yeah. And that makes sense too. Sorry, I'm jumping in again. I mean, that makes total sense. But to see that for me at least, to see these numbers the way that these numbers are, even when we've been sheltered for 2 months now, that's crazy to me. So what happens when everybody goes back is that, you know, you hear so much about herd immunity, and you hear so much about the other swing, which is like, this isn't going away until you get a vaccine. So it's just hard to, I don't know about you guys, but I feel in such like a weird state of what, I don't know what to believe. And, you know, everything in life is like, you hear this side, and the truth is in the middle. But in this case, like, I don't want to gamble with a predictive middle truth. You know what I mean? That's just been where my anxieties have lied.
Yeah, I agree with you, Les. Like, I think that's what's scary. It's like, you know, you're gambling with people's lives, and it's like, you know, I don't want to be stuck inside, but I am willing to do it if I'm going to help somebody who's immunocompromised, you know, even if it does last a couple more months. But of course, I want to believe that it's, you know, it's going to end soon. But yeah, I don't know. I really liked what she said, though, about how she thinks the news should kind of focus on educating, especially about the gloves.
Yes.
Like, I think, you know, it just feels like the same thing I'm hearing over and over again on the news, and it's disheartening. But if they were to shift their focus a little bit to help the public and kind of be like, if you do this and this, you'll be that much safer, I think it would be hugely beneficial.
Agreed.
Yeah.
Additional action items. I like it.
I mean, I feel like same as you, like, what if we don't know, you know, like, and the cases of death are more isolated than we think, which isn't probably the case. But I mean, just to look at the other side, like,
yeah,
I mean, I don't know. I mean, like, you know, so listening to her talk like that, I'm like, wow, like, and if you could see it, I was kind of like, wow, well, so tell me more about that, because I haven't heard that before. And then too, about like vaccination, you know, like, I mean, she's in a situation where she asks every single person, have you been vaccinated for the flu? And people generally say no, or, you know, 50%, I guess she said,
right,
don't get vaccinated for the flu. But I think you're right, Dave. I think comparing this to the flu is tough, especially for us, especially for me as a non-healthcare person. Like, I don't know what the disease state is, but it seems even like most doctors don't even know what will come of COVID, like what the symptoms are. Like, they change so often. Like, now I'm hearing like strokes and
and Kawasaki's disease in children, and
yeah, and
it's just bonkers.
Yeah. So what do you think, Shel?
It's like, I think that, you know, numbers are going to continue to come out, and we're going to see, like, okay, what is the death rate? Because, you know, not to compare it to anything else, but like, what is the death rate? And looking at that in a way that, you know, we don't want to put anyone at risk, but those people that are dying from COVID, can they also die from these other viruses that are going out there? Like, you know, so if they didn't die from COVID, if they came in contact with someone with something like influenza, like, would that have the same end result if they didn't get the vaccine? You know, so and you know, and I know, like, the economy is a tough subject. You know, it's not economy or life. Like, that's not what we're talking about here. But we can't, you know, I'm not a business person. I'm not an economist. And I'm not a healthcare worker. So I feel like this is just an open conversation where we're like asking the questions, right? You know,
opines.
Exactly. We don't know what we're talking about, but, you know, I think our policymakers and our lawmakers have to look at that and be like, hey, how long are we going to keep these businesses closed? And what does that look like when they reopen? Because we still haven't seen a lot of it. A lot of what we've seen so far has been has been recalled, right? Like all the information. So, and I think that goes back to your point about just education. Like, if I'm totally down with wearing a mask to the grocery store throughout the summer and throughout the fall. Like, I'm going to be buying grocery stores for my parents throughout the fall. That's just the way, like, I'm fully prepared for that. But, I also think that if I'm going to the grocery store for my parents, I also think that I can invite them over and we can have a barbecue in my backyard, everyone wearing masks and everyone social distancing, and maybe not right now, but at a certain point, maybe by the end of the month, that might not be taboo anymore, right? So I feel like as a society, we're going to evolve on our own, no matter what the lawmakers say. And I think we have to listen to them. We have to trust them. Yeah, I don't know.
Yeah, it's hard to do.
Yeah, and I think everyone's gonna have to make their own decisions on that based on the information they have.
Address, I had another similar 150,000.
The concern is that there's no linear leadership that's just saying this is what's going to be happening in all states. So with each state kind of like deciding what they want to do on their own, it just gets dicey. Like, how do you know? Like, how does this one governor know that their state's fine, and then another governor thinks that their state needs to be quarantined? So I think it would be cool if there was just one path that we all knew to follow. But I don't know if that's as right now.
I think that's interesting too, because, Pennsylvania is not Oklahoma. Oklahoma is not New York. So, and the different industries that are in these different states don't react the same to businesses shutting down. So I actually kind of disagree. I kind of like the idea that each state is taking the information and making a hopefully educated decision on what's best for their environment. And we're even seeing, like in Pennsylvania, they're not opening up the entire state at once, right? They're focusing on the counties that aren't hit as hard, opening them up a little bit, kind of using them as guinea pigs, and then slowly going to the bigger cities. And so I think it's honestly, it's the Constitution, right? Like, states can, do what they want, and federal government has limited power. But I think that's the best mode of action for this, and I'm glad that they're planning.
And I agree. I think each state needs to be customized, but there needs to be something that they can customize around.
True.
So there has to be some sort of like here's the bar. You do it whenever you reach that bar in your state. Here's the bar economically. Here's the bar health-wise. Here's the bar safety-wise. Here's the bar in terms of people being ill or not ill. Here's the bar with antibody testing. Here's the bar with any kind of healthcare needs that you have. And once these bars are reached, then your state's free. Not like, well, you might decide that your state's in the yellow and because of this parameter, when another state decides that they're in the yellow when they have this, and this. I just think it would just be helpful. Leadership is about like communicating one thing and being clarity, some kind of clarity. Like, this is killing this many people, so stay the F home. Or, you know what I mean? Like, anything would be good. Or like, any kind of little symptom, of this, don't do it. Stay, anything, any kind of direction, I think people would be, I would feel, anyway, I'll talk for myself, I would feel, safer. I would feel better about it, but we'll see.
This
church
interview was amazing.
Thanks. I loved a good perspective.
She is an awesome human being and like strong, resilient, and an incredible nurse.
It's amazing.
Helped my kids through a lot of stuff. So thank you to Deb, and thanks for causing some conversation. Yeah, what else do you guys think?
Yeah.
Thankful for her.
Yeah, so thankful.
Well, guys, it's another one in the books.
Yeah.
Thank you guys. That's a wrap.
Have a good day.
Peace out.
Bye.
Thank you everyone for listening to today's morning cast. We loved having our morning coffee with you. Make sure to subscribe on YouTube, Spotify, and SoundCloud, and turn that notification button on to make sure you don't miss any episodes. Until then, keep hustling and pour yourself another cup of joe.